Welcome back to my channel. My name is Amna. I'm a fourth year veterinary student, and in this video we are going to talk about the concept of anesthesia. What are the major procedure or the protocols which are involved while giving anesthesia to the animals? So without further ado, let's talk about this. So what is the importance of the anesthesia? Firstly, we use anesthesia to relieve a pain for amnestic purposes. So, what is a pain? Basically, pain is electrical impulse that travels from a nerve ending through a nerve tract and is perceived in the brain. So, basically, brain is a major thing which perceive and then signals send the signals that in the particular part of an animal body there is the pain and the animal perceive it. So another reason would be to calm a furious animal, right? Another maybe to make an animal feasible for surgical procedure. So these are certain main thing that therefore we use anesthesia. Otherwise, there are multiple important roles of anesthesia as well. But in this video, we will mainly talk about what are the steps involved that we give anesthesia to the animal. So the animal is coming into our clinic that is in the full conscious state, and when an animal is in full conscious state, we cannot provide anesthesia. We cannot perform the surgical procedure. The animal may be the conscious. The animal may be in anger state. Animal may have a stressful conditions or a painful conditions, and cannot let a doctor to come near to the animal as well. So how we can diagnose, how we can treat, we can perform the surgical procedure on that animal. So therefore we have to convert the animal from conscious state to the unconscious state. So later we will achieve the unconscious state in animal. So what are the basic steps which are involved? So basically there is one thing. Here is the animal awake, right? And here is the sedation to the animal, right? We give sedation with multiple drugs like the xylazine and the acetaminophen, or other drugs like the any anticholinergic drugs are used to provide a sedation to the animals. So there are stages of the sedation: light sedation, moderate sedation, and the deep sedation. And these are the things that maintain that sedative stage, like the hypnosis drugs and sarcotic drugs. These are used to maintain the sedative state and to provide an animal with deep sedative stages as well. And here we have the general anesthetic procedures, like so animal convert from light to the deep, and in between that we have to perform our surgical procedure, right? So if we have to provide the overdose, if we see the animal is about to convert to the light stage, then we can provide the overdose of that anesthesia to make an animal on the deep stage until and unless our procedure accomplishes or finishes, right? And after that, after the overdose, after the surgical procedure, the animal is going to recover from that stage, recover from the unconscious state. As we know that anesthesia is a reversible state, not the irreversible state. So this has been seen that before the anesthesia, we most commonly use the pre-medications. In the pre-medication, certain xylazine and other drugs are used. So why they are used? And as we know that they are accepted standard of care. And on the other hand, as we know that the animal may have a stress, may have a pain, and in the stressful condition, there is a hormone releasing inside the body that is known as epinephrine. And epinephrine is released in the fight or flight condition, and stress is a fight or flight condition, and that may causes arrhythmias like the respiratory arrhythmias, the abnormal breathing, and the heart arrhythmias, tachycardia, and the bradycardia. So, if we directly provide anesthesia to the stressful condition, these signs and symptoms, these problems can arise. But therefore, we have to remove the stress, we have to remove the pain, we have to make the animal to lose the awareness around the surrounding, what is happening around the surrounding. We don't want it to animal to remember that, right? So therefore we provide the pre-medications to the animal, right? So as we can say that pre-medicated patient is a calmer patient, and it is easier to handle that patient. So it also decreases the amount of induction and inhalant anesthetic used. The most important thing is that what is a sedation? We talk about light sedation, moderate sedation, and deep sedation. So, what is the sedation basically? So, it can be defined as the loss of the awareness, right? Animal will have no idea about the surroundings. Animal will feel relaxed and become calmed for further procedures. And for sedation, we use the xylazine, anticholinergic drugs like atropine sulfate and glycopyrrolate. So these are best sedative drugs which are used in veterinary clinics. Xylazine is not being used in for the human side, but it is specifically is being used in the animal sides, right? If we talk about anticholinergic drug, so they block the effect of neurotransmitter that is known as acetylcholine. Acetylcholine is a very famous neurotransmitter. It mainly affect the involuntary muscle contraction. And what is a neurotransmitter? I have already made the video on the neurotransmitters. So if you don't know about the neurotransmitter, you can go back and watch that. So anticholinergic are those drugs which affect the transmission of the neurotransmitter, and that particular neurotransmitter is acetylcholine. And anticholinergic drugs can cause decreased livatory secretions and gastric movements as well. So therefore, with the xylazine, anticholinergic drugs are being used as they decrease the salivary secretions. And when an animal is being on the anesthetic stage, so these salivary secretions from the mouth of an animal can cause a lot of irritation, a lot of problems. So this is a very important point. They also increase the heart rate. So contra indicators include tachycardia and history of the heart disease, right? Pre-anesthesia include light sedation, moderate sedation, and then the deep sedation. Xylazine, if you talk about xylazine, it is a alpha 2 agonist, adrenergic 2 agonist. It is a pre-anesthetic as well as an analgesic, pain-relieving drug. Xylazine increases the activity of sympathetic nervous system. As we know that there are two types of nervous system: parasympathetic nervous system, which is most importantly working in a normal state, while the sympathetic nervous system, it is activated when an animal is in the fight or flight stage. Or it stimulates the vagus nerve, which is a cranial nerve. As we know that there are I think 12 cranial nerves, and one of them is the vagus nerve, and which cause the vomiting in animal. And the side effect of xylazine is the bradycardia. It decreases the heart rate, and therefore we sometimes have to use the ventilator as a restrainer. It is also being used. The antidote of xylazine, when we provide the anesthesia xylazine, the antidote of the xylazine is yohimbine, which can reverse the adverse effect of the xylazine if administered intravenously shortly after xylazine administration. So if we talk about the ketamine, so ketamine got its start in the Belgium in the 1960s as an anesthesia medicine for the animals. And unlike the other medicines like the anesthetic medicines, ketamine does not slow breathing or the heart rate. So patients do not need to be on the ventilator to receive it. What are the tranquilizers? Tranquilizers are the drug which provide the treatment of the anesthesia of the anxiety, fear, or tension, or agitation, or the disturbance of the minds. So tranquilizers are very important to maintain the state of animal when the state of animal is having anxiety, fear, or animal is having attention, agitation, or such type of the situations. And hypnotic drugs produces drowsiness, and facilitates the onset and maintenance of a state of sleep that resembles natural sleep, to keep an animal relaxed, quiet, and still during moments of the fear and stress. Pentobarbital, chloral hydrate, these are the drugs which are used in the hypnosis. So, after the sedation, we most commonly use the hypnotic drugs or hypnosis to maintain that sedative stage. And then we have narcosis. So, what is the narcosis? A state of stupor, drowsiness, unconsciousness, right? So, it is a stage of deep unconsciousness that the animal will have amnesia as well. Animal will unaware of the environment, and animal will have no memory about the surroundings as well. So it is also known as a deep sleep. Certain major tranquilizers are used in this stage, like acetylpromazine, morphine, and it causes the extreme sedation to the animal. For general anesthesia is given through two routes, IV or the inhalational, and these are the drugs which are used in the general anesthesia: ketamine, propofol, or thiopental. So general anesthesia called amnesia causes the amnesia, the loss of the memory, and the animal move from light stage, and when we achieve the light stage, then we perform the surgical task. And as we know that in general anesthesia, the whole body of an animal is having anesthesia. The whole body of animal cannot sense anything from the surrounding, cannot sense anything, cannot have a pain in the body as well. So most commonly when we have a major surgery, we perform the general anesthesia. And then after the surgical stage, after the surgical work, right, after the surgical procedure, the animal will go to the recovery stage, right? So anesthesia is a reversible stage. Animal will have a recovery. Otherwise, if deep anesthesia continues, animal will have a coma, and now from the coma, animal will have a death, right? So anesthesia is a bit riskier task, and therefore we say that there are no there are no safe anesthetic procedure still known today. But there are only one thing, that the safe anesthetist. The veterinary doctors are the one who can give the safe anesthetic drugs, so that the life of an animal could be saved from the dangerous state. So this is all about this is all about this video. Hope you understand this, and thanks for watching this.